Hello everyone, I am urologist Omar Makaya. The subject we will talk about today is premature ejaculation surgery. What is the success of premature ejaculation surgery? What are the early-term results? Does it cause erectile dysfunction? What are the long-term results? How is the surgery performed? If you are ready to listen to these in detail, here we go, friends. I have shot many videos about many drug treatments, spray treatments, behavioral treatments for premature ejaculation before. There are many treatments for premature ejaculation in these videos. When a patient goes to a urologist, if he does these treatments, especially behavioral treatments, most of the patients overcome this problem. There is a saying for premature ejaculation: it is not fate, it is a decision. If the patient does not benefit from these first-stage treatments, there is a penile head filling procedure. We shot a video about this too. If the patient does not benefit from the penile head filling, then we can perform premature ejaculation operation. How do we perform premature ejaculation operation? As seen in the image, there are thin, millimetric nerves on the back of the penis. There are millimetric nerve bundles on the back of the penis. These nerve bundles take the sensation of pleasure in the head of the penis and take it to the brain. These nerve bundles are more and thicker in some patients. And it takes the pleasure to the brain very strongly. And the person cannot fulfill ejaculation control due to this pleasure and ejaculates very early. There are some patients who have ejaculated in 1 or 2 minutes all their lives. He might even have intercourse for the second time. If the first intercourse lasts 1 minute, the second intercourse lasts a few minutes. And unfortunately, the person cannot satisfy himself and cannot satisfy his partner. A significant number of these patients have definitely tried drug treatment, spray treatment, behavioral treatments. But they may not have been successful. Because it is said that there may also be hereditary causes in premature ejaculation. These patients constitute the most suitable patient group in my opinion. Because in this operation, we make an incision in the area where we make circumcision incision. And we peel the penis skin backwards like peeling a glove. When we peel it, these nerves appear before us. Thin bundles lying on the back of the penis, as you can see in the picture. Now in this picture, for example, 8 nerves are identified. 5 of them are eliminated. 3 bundles are left behind, friends. And the sensitivity of the patient's penis head is considerably reduced. And the skin is closed after the procedure. And then the process is over. What happens then? Of course, the time the patient spends in the vagina is getting longer. It gets quite long. So if the patient was used to spend 1 minute, it can go up to 5 to 15 minutes. The second advantage is that the patient starts to get a much better response from the methods and drug treatments he learned for premature ejaculation. The patient starts to return to normal. And the third advantage is that this treatment continues to be effective for life. Let me also say this among the advantages. We do not expect any loss of erection. Why? Because these nerves are not related to the mechanisms that provide the erection mechanism. They are the mechanisms related to the feeling of pleasure. So these are the advantages. What are the disadvantages? To talk about the biggest disadvantage, the long-term results of this surgery are not known at the moment. Because this surgery is not a surgery that is already performed in Europe and America. This surgery is done a lot in Far East countries, especially in South Korea and China. And it is a surgery from there. And unfortunately, the results of this surgery in 20 to 30 years are unknown. What could be the results now? Where are the question marks? We need to say that. With aging, erection capacity decreases every 10 years. Erection quality, pressure and hardness in the penis are already starting to decrease. And in order to get an erection with aging, the amount of pleasure needs to be higher. The external stimulus needs to be stronger. The external stimulus needs to be perceived more strongly. Can a person who has had this surgery in his 20s have a problem with his erection capacity after 30 years? We do not know this for now. But we know that there will not be a problem in the near future, in a few years, friends. This is the biggest handicap. But we should also say that this is not an operation applied to every patient. This is an operation preferred in patient groups with lifelong premature ejaculation and who have not really benefited from other treatments. What are the advantages and disadvantages compared to filler injection? The effectiveness of filler injection has a certain duration, friends. According to the studies, it has an effect of around 3 to 5 years. The success rates of filler injection are generally around 70 to 80%. There are also studies claiming 50%. The success rates of this surgery are around 70 to 90%. It is a very effective surgery. One advantage of filler injection is that it can be done in 2 sessions. For example, we made filler injection to the patient. The patient had intercourse. A month passed. When he says, "This is not enough for me," then we can do another session of filler injection in the same area. Or we made filler injection. However, the patient's sensitivity decreased a lot. When the sensation decreases too much, we can dissolve the filler using hyaluronidase enzyme. But there is no such situation in surgery. When we cut the nerve in surgery, we have no chance of joining that nerve again. Because these are millimetric nerves. It is very effective in selected patient groups. It is a simple operation. The risk is quite low. But the treatment protocol is not yet established in the European and American Urology Association. But it is a very common operation in the Far East, friends. You can write in the comments if there are topics you are curious about or if there are questions about premature ejaculation. Our contact line is already in the description box, friends. You can reach from there if you want to ask anything. Thank you for listening. Best regards.